Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. I'm today joined by Allison Raffaele. She's the CEO of Medical Health Associates of Western New York. This is a leading pediatric health care group serving families across the region. Thank you for joining the podcast.
Thank you for having me.
Absolutely. And just to get us started today, give us our listeners context. Tell us a bit about your background.
Sure. So I've been in the healthcare realm for over 20 years now. I actually started out as a surgical tech way back in Boston, Massachusetts, which was a great introduction to the healthcare realm. But I quickly realized that I loved healthcare, but I didn't ever want to touch a patient. But I wanted to be in that arena. From there, I ended up getting a bachelor's in human services with a concentration in family studies. During my undergrad, I spent a lot of time working in a hospital system where I got the chance to do a lot of different things. It was a fantastic experience. I worked as a business analyst. I worked as a unit secretary. I worked front desk. I really got to know the ins and outs of a hospital. And then from there, life turn of events took my husband and I to Western New York from Boston, Mass. And I worked in a couple of big hospital systems here in the Western New York area before finding a long-term position at a private OBGYN office, which I loved. It was a great experience that took all of my strengths from outpatient hospital and really made it my own. During that time, we moved that office, we hired new doctors. It really gave me a chance to make it my own. It was great. After about 8 years, I realized though I had reached the ceiling and that I wanted to move on. Before moving on, I thought, well, maybe I just need a little bit of a challenge. So I taught at a local college one evening class. It was basic medical terminology and basic anatomy that I quickly realized I have no business being a college professor. I like to teach people, I like to mentor people, but teaching was not for me. So then I decided, hey, it's COVID times. So what better time to look for a job? Not really. But I found myself taking all of my healthcare experience and applying at a veterinary hospital, which was great experience. Again, taking everything I learned from outpatient medicine at the OBGYN practice to everything hospital related. The hospital had an MRI, it had neurosurgery, it had chemotherapy, an emergency room. It was great, but human medicine, as I call it, is really where I belong. So human medicine afforded me a wonderful position, which I'm in now. I've been here for coming up on 2 years as the CEO at Medical Health Associates. What's great about this position is it's really taken all of my strengths and rolled them into one position. So I work on a lot of contract negotiations. I work on employer contracts, vendor relationships, higher level recruiting and staffing, employee satisfaction, and patient engagement. It's really been kind of the next step in my career and a step that I'm very proud of and really enjoy coming to work every day. We have 8 location pediatric group. We have about 5,000 active patients within the
Wow,
group, and we see about 120,000 visits a year.
that's amazing. Very busy, it sounds like, from what you're describing. So, and
Yes.
your particular patient population is it all pediatric right now?
It is. It's all well visits. So well visits and sick visits. We don't do
Okay.
any specialty care. We do have either social workers or licensed mental health therapists in each practice, which is super helpful. But it's pretty much annual physicals, sick visits, those kinds of things.
And like when you look at your own role right now, like where are you spending the most energy in your day to day? Just so the audience can understand at your level, like what are you worried about? What are you focused on?
Wow, that's a great question, and it does change a bit depending on the day. But I would say that the real big things that currently I'm either worried about or focusing on, technology has really been the big thing over, I would say, even the last 10 years. Just keeping up with the changes in with AI and how that's affecting practices, making sure that our providers are using technology to make us more efficient or help us be more efficient. Then, of course, reimbursement and potential changes that could be coming is a concern. One of a lot of our practices have a heavy Medicaid population. So we just worry how some of these changes down the line might affect us. And then I think something that every leader worries about is their staff. Are they happy? Are they going to leave us? Are they, going to all of a sudden become part time or per diem? Is someone going to go out on a leave? Those are the kinds of things. Are we still going to be able to take care of our patients when we have, things that happen in people's lives that are just out of anyone's control?
Yeah. And what's one shift in this industry, specifically pediatrics, that most leaders are not paying enough attention to right?
I would probably say the adopting technology right now, of course, with the Microsoft upgrade that is happening in October, we're switching our whole company over to Microsoft 365. And that's been a very big change for a lot of people that have, perhaps worked here for 15, 20 years, and they've always just used our EMR as, messaging and those kinds of things. So trying to effectively communicate and use technology to our advantage has really been a bit of a struggle I've always been big on explaining the why we're doing something to people. And it's hard because you have all these day to day responsibilities of taking care of patients. If, you're a provider, if you're a nurse, it's callbacks, it's answering the phone. Our front desk is doing a great job with verifying insurance, updating primary care, doctors, all of those things. So when you stop and think of all of their responsibilities and then you say, we're going to throw a new technology platform at you, that can really be anxiety provoking to many as, it's something new, it's different. I kind of think of it like when text messaging became a big thing. And some people were like, what? I'm going to send a message on my phone. So it's sort of like that, except on a much, much bigger scale because we're still trying to see patients. We're still trying to do all of this. And now we're introducing Teams and we're introducing SharePoint. And, I would say that's one of the bigger concerns right now is just the technology implementation.
Yeah, it's at top of everyone's mind, it's be like AI and these other topics
Mhm.
as well. Have you adapted any of these technologies just out of curiosity, like ambient technology? I'm sure is like another hot topic in the space right now.
It sure is. So we've actually implemented it kind of on two levels. At our corporate office, we are using some basic AI platforms for cleaning up policies or the occasional write this letter to an insurance company, asking any of those AI platforms to do that. That's something that I've worked with my leadership team as well. There's about 18 managers and supervisors that I meet with on a regular basis, and just showing them the benefit of how fast we can use this platform to make a policy, to make us a sign, an invitation, those kinds of things. But then on the flip side, we're also trialing an AI platform in one of our practices. Two providers are trying it where the platform basically dictates the note, and they're not. We use a voice recording software to do our notes, but this is more of the provider goes in with the patient, they have a conversation with the patient, they go through the review of systems. Before the visit, they obtain consent from the parent or the patient if the patient's old enough. And then they literally say, I'm recording this. And then our AI platform will generate the note. What we're finding is that it down the road, I think, will be absolutely stellar in terms of increasing our efficiency, helping providers be able to do notes in a timely fashion without taking work home or those kinds of things. But we are having to teach the AI platform some of the intricacies of our visit notes. So I feel like anytime there's technology, yes, it can help you, but you have to take the time to learn it or to teach it.
Teacher.
So in this case, I am very thankful to the providers that are trialing it because there have been some little frustrations that come with new technology, especially when you're talking about AI.
Yeah. And like, what have you seen too? I've seen the negatives in the IT space as well. What happens on your side, like in the PED space, if like, and this is not even for your organization in particular, what happens if people try to ignore these technological changes in the long run? Do you have any predictions or insight on that?
I think that it will lead to frustration on all sides. I think technology can be a blessing and a curse in terms of it can do so much for us. But if you don't have the time to, as I said before, actually sit down and learn how to use Teams, how to use SharePoint, these kinds of things, then you're going to be frustrated when you're trying to either find a document or join a meeting, those kinds of things. So, my prediction is, at least for my group, is that the technology implementation really needs to be rolled out in a very strategic, organized fashion. And if people aren't taking the time to either watch training videos or do some modules that we're creating to send out, it's really going to create frustration for them in the long run.
Yeah, mindset too sounds like as well as like understanding things are changing and we know
Mhm.
it's difficult and just confirming their feelings and trying to work their best with them and provide education.
Yeah. And of course, everyone's going to learn differently too. And I think that that's one of the biggest things is, we have some of our younger generation that's as tech savvy as can be, and they, can do half of these things with their eyes closed. And it's what they have always known. They didn't know a time where, when we were kids, we didn't have cell phones. So, in New York State, it's a cell phone ban in schools right now. And, we didn't know any different. We survived without cell phones. So trying to, some of the younger generation doesn't necessarily understand where we were before. And then some of the older generation may have trouble adopting it, and that it is something new and it is out of their scope of comfort too. I think a lot of it is people tend to get nervous when they don't understand things, and that can lead to frustration and discontent.
And even when you look in the nitty gritty of operations, like the day to day, where do things still feel clunky or slower than you'd like that you see at your level as a CEO? What are your observations there?
I would definitely say with medical billing, there are some insurance companies that we still have to submit paper claims to. There are some insurance companies that send us paper checks, which, when you think about all of the people that touch a paper check, everyone from the person that actually, I mean, if there is a person putting it in an envelope or a machine, but then someone picks it up, the postal worker actually delivers it to us. Someone here needs to open it, then that person needs to give it to the accounting department, who then needs to process it. And just the steps go on and on and on. And then someone takes it to the bank, or we actually just got a remote check scanner, so that that takes that human element out of it. We're not
Out of it.
sending someone to the bank. It just makes a lot more sense. But those are some of the things that, trying to, just when we get these paper checks, it's like, oh boy, another paper check. Where if it comes in electronically, many times it automatically posts right to the patient's account, which is a very efficient process. But I would say that aspect is definitely clunky. Medical offices tend to still use faxing, although it's not a paper fax anymore. It's usually an electronic holding tank. I think that's something that's very clunky. Um, you ask people in different industries if they have a fax machine in their office, and they look at you like, what is this, like 1995? Where you have
Exactly.
a fax machine? So there is definitely, healthcare across the board, I think, is really lacking on the technology side of electronic documentation sharing.
Yeah, there's definitely opportunity there to make it better for everybody.
Mhm.
And then for specific to your patient flows, how do you handle things with your PEDS patients around follow-ups, no-shows, or like, manual outreach? What does that look like today?
So we do a couple of different things, and some of our offices are a little bit different, but for the most part, we have an online platform that we were doing reminder calls up until a couple of months ago. And then I was looking at some data, and so many calls weren't being answered, or the voicemail was full. And we were paying for a service that really, it's an automated service. So I said, why are we doing phone calls? Let's get rid of the phone calls and let's just do text messaging. Well, now we have a much better rate of people actually getting the text message and confirming it. Our text message platform has the, reply, why to confirm and to, reschedule or something like that. So we do that. We also do pre-visit check-in. We send a lot of developmental screenings through our patient portal. We encourage patients to use the portal. One of our practices is doing online scheduling, which has been a huge patient satisfier. Parents have the ability in the middle of the night to book a sick visit. So if you know your child has an ear infection and it's 3 o'clock in the morning, you want them in as soon as possible, being able to log in to the computer and schedule them for that, 8:15 a.m. appointment. You know they're going to the doctor and you're not going to work that day. So why not schedule it at 3 o'clock in the morning when you're awake? So parents have really, really, we've gotten some excellent feedback about the online scheduling.
It's amazing. And what kind of difference, out of curiosity, did you see in like your metrics from like those telephone call outreaches, follow-ups to the texting? Is there like a percentage that you saw increase, or how did that happen?
I haven't actually run the numbers for the percent increase, but our platform has little visuals of red or green basically. And you can see the green ones have been confirmed. The red ones, either they couldn't get through or they need to reschedule. So just being able to see the amount of green is
Mm,
very
positive.
reassuring because
Yeah.
so frequently I would log in and just to see, where we're at and just a lot of red. And it actually saved us money too because we were doing phone calls mostly with some text messaging, but eliminating the phone calls reduced the price. So we save money. And I think our patients like it much more because it's on their time when they choose to look at the text message. And, we've all done it. We get that phone number calling and we know it's our doctor's office calling and we just send it to voicemail. But if the voicemail is full, most of the time the automated robot calls back.
Yeah, that's amazing. Sounds like amazing results that you were looking for, and you just went for it, which was amazing. You made that big change from the
Mhm.
telephone calls. And then kind of like current results question again, what's working really well right now that you would never want to lose?
Is working very well. I would actually say, which you may laugh, but our central billing office is working very well. As much as sometimes, we complain about our paper checks that some insurance companies have or our paper claims, we've been able to reduce our overall days in AR by about between 3 and 5 days, depending on the group, which is huge. And just by we used to outsource our billing, but then I said, "Hey, I think we could do it better if we brought it in-house." And that was a risk. It was definitely a risk. And I was worried that, there's always that I'm a risk taker. And there's always that part of me that says, is this really going to work? And, if it doesn't work, we go back to doing what we used to do. But at the end of the day, sometimes you have to take some chances and bringing our billing in-house, all of our staff, they're really engaged in the process. They're making phone calls for collections, they're following up on denials, our claims are going out timely. It's been an excellent, we brought it in-house in April and just in the few months that we've been doing everything in-house, it's been excellent. Of course, there were a few, you know, bumps in the road, as with anything when you change a process or bring a new service in. But for the most part, it's all the kinks have been worked out at this point. So
Yeah. And looking at the alternative, like the opposite end of the spectrum, what's been harder than expected despite all the effort that you've put into it?
been harder. I would say communication, and that there
Yeah.
are so many ways that we as adult professionals communicate, but we often forget how people communicate differently and what one person might prefer to have in a text message. Somebody else wants a phone call. Somebody else wants an email. Somebody doesn't want to know anything. So you get those people too. I would say and I try to over communicate, whether it be with meeting minutes, text messages, just so that everybody gets the message. But there comes a point with 250 employees where you can't always be adapting to everybody's own communication style when you have 250 people.
Yeah, that's a lot of people to manage with all different variants of how they like to communicate. Um,
Mhm.
and if you kind of got through all these bottlenecks of communication and these other things of technology we talked about, what would success look like for you in 6 to 12 months?
In a perfect world, we'd be fully implemented to Microsoft 365. Everybody would be using Teams. I came from a practice where we used Teams and SharePoint every day, and it worked seamlessly. So I would say 6 to 12 months, that would be fantastic um, if we were successfully able to do a full company implementation with people really learning and, embracing it and not necessarily being afraid of it.
Yeah, absolutely. Eventually, even further past that, probably become evangelists. Like they're just very happy. Yes, it was painful maybe at first, but we learned to overcome it and have the
Yes.
right mindset and get through it. So
It was like when we brought our billing in-house, it was painful and we worked through it and we worked a lot. There were a lot of things that we did, but it was a little bit of pain for, I feel like, long-term gain.
yeah, absolutely. And as we're at the end of the podcast now, where can people find you online? Where can they learn more about Medical Health Associates?
Sure. I'm on LinkedIn, Allison Raffaele. You can also find me on the MHA of Western New York webpage. My contact info is on there.
Excellent. Well, thank you for your time today. It was a wonderful discussion. I'm sure our audience will get a lot of it. Thank you for your time.
Yes, thanks so much for having me.